Welcome to our session on using scenario-based learning to teach critical CNA soft skills. I'm Denise DuBois, and I'll be your moderator today. But before we begin, we've got a few housekeeping details we would like to go through first. First of all, our session is being recorded today, and at the end of the session, you will be receiving an email with a link to the recording, along with a link that has all of the URLs and information referred to throughout the webinar today for your convenience. We will also be giving you a certificate of attendance for spending the time with us today. And we will be having a Q&A session at the end. So if you have any questions as we go along, feel free to type those questions into the chat area on the screen. I'll be watching the questions, and then we will take all of those at the end of the presentation. We are very pleased today to have a guest presenter. Kimberly Harper is with us today, and I'm going to let Kimberly introduce herself and give you a little bit more information about her. And with that, Kim, I will turn it over to you.
Awesome. Good morning. Thank you for allowing me to join you guys today. My name is Kimberly Harper, and I am a registered nurse with over 17 years of experience. My background includes clinical instruction with nursing students and nursing assistants. I also collaborate with states and across the nation to help with innovation, with teaching and different aspects of providers. And so I've had the opportunity to work with scenario-based learning and to integrate that into my classes with my nursing students and my CNAs and other programs that I collaborate with. So I hope that the information that you have here as I share is definitely helpful for you all. I'd also love to kind of get an idea of who's in the room with me today. So if you could just put in the chat box, make sure that you share to all panelists. Just kind of give me a background of who is in the room, whether you're a nursing instructor, a CNA instructor, a high school teacher, all those things. I'd love to see who's in the room. I'll give you a minute to. Awesome. So I see some community college nursing instructors, some faculty in high school. So hopefully I think our process today will kind of provide an overview of how you can utilize scenario-based learning, the techniques, and how to actually incorporate it into your soft skills as you're working with this as well. So go ahead and go to the next slide. So what is scenario-based learning? When I think about scenario-based learning, I think about methods of facilitating active learning opportunities, where you're able to develop a method to use real-life scenarios that provides an opportunity to create a relatable learning experience. I know for me in nursing school, being able to have the opportunity to practice something before I actually do it was very important. And so when we're able to create these methods, I try to do this all the time when I'm working with my students, to create an opportunity for them to kind of practice the real life scenario before it actually happens. And I also do this a lot with my facilities and hospitals that I collaborate with, and being able to work with them to kind of create the real life scenarios prior to actually going into them. It also builds a foundation upon the skills that have been provided. So we know that if you use your curriculum, you have those conversations and you teach this knowledge and these skills, but then you're able to kind of go a little bit further than what you can do with just the information that's given. So why use scenario-based learning? We use that because it gives us the opportunity to validate the methods that have already been learned that you utilize when you're teaching. Then it also gives us a method to kind of establish behavioral changes. So we know that we can translate the knowledge that's provided in the educational setting, in that atmosphere, but then we want to make sure that there's any aspects of a behavioral change that may need to take place. We can see that in a scenario experience. And then the last one is we can also increase critical thinking skills. So we can give the information about blood pressure, but then actually make sure that we're able to kind of go in and see that our students are translating that knowledge and they're actually being able to increase that critical thinking process. So if we review the blood pressure measurement, for example, we have an opportunity to begin testing the learner's responses to different scenarios. So we know in health science that we've used the power of scenarios with standardized patients for years to help teach key nursing skills and technical skills as well as soft skills. So sometimes your scenarios will include the use of like simulator, like that's pictured in the here, as well as hands-on resources. So here you can see two examples that are different ways to learning. So the first is a photo using the blood pressure simulator on a standardized patient. And I really love using standardized patients when you're having the ability to have conversations. And one reason why I find standardized patients are important is because it's not just having that student or another student respond, but you're actually having a patient that would have specific responses back to you in relation to what's being said or what's being done. And that's very effective when you're considering the soft skills that need to be taught. I know I've worked with a few states recently that has translated to using telehealth experiences across the nation. And one thing that they found was that providers didn't necessarily know how to communicate using the telehealth platform. But when you used a standardized patient, they were able to actually think about the conversations and how they may actually come through, and that helped them to connect and make that connection. In general, so being able to use the standardized patient and with the blood pressure scenario as an example of how you might use this with your CNA students. You can also create scenarios you want to have one student be the nurse and actually learning how to take the blood pressure for a specific type of patient and then switch roles. The added benefit of a wearable simulator, such as a blood pressure simulator, is the student is also practicing that soft skill communication. On the other side, you see a generic mannequin that can be used a wide variety of scenarios to teach and practice all sorts of basic nursing skills. And you can also use communication, teamwork, problem solving, and you can also have the CNA in a nursing home also use a simple, this type of scenario. So it could be a transfer from a bed using this process, or it could be simply how would you go in and have conversations, and especially in the newer nursing assistants and nursing students, when they're having doing their first procedure, being able to integrate those aspects of it, and also having the ability to have conversation is important. The experience of kind of walking in someone else's shoes as the patient also helps to make the role a little bit different, because that way you can have the conversation about what was that like for you when you were playing this role, as opposed to having a standardized patient. So that way you can see from either the nursing student's perspective or the CNA's perspective how it's different from you for the patient's expected perception. So here's an example of if you were going to use the blood pressure for kind of prior to actually starting a scenario-based experience. So you're going to focus on a skill like taking the blood pressure. You know, students, I know it looks like most of you guys are already in either a community college or a high school setting where you would actually provide the basic knowledge about what's actually to be seen. So you would know the different, what hypotension is, hypertension, and you know, a lot of times when we're doing the process of comprehension and kind of remembering these different things, a lot of students are able to process that. But using a scenario-based process allows you to see what the students may actually be verbalizing or visualizing as they go through the process. And that can be helpful to learn what other techniques you might actually incorporate into your process. A lack of understanding of these concepts may result in less buy-in of the scenario featuring the blood pressure. So if you wish to teach soft skills specifically using a scenario, I wouldn't introduce new technical skills until you understand and you know that there's a foundation currently there. Okay. So this is a scenario looking at how blood pressure focusing on soft skills of empathy. So this scenario is in the lesson. This lesson come before the technical blood pressure lesson in order to engage students and to get them to think in a more empathetic manner. So how could you also use a scenario like this at the end of a lesson? So in that case, you want to kind of build upon what the learner has already known. So we can see that Ben is a 9-year-old boy who comes from the clinic for his first sports physical, and his mother accompanies him. The medical assistant comes into the room and says, "Hi, Ben, my name is Katie. Put your arm on the desk for me so I can take your blood pressure. And then everything will be fine. Just give me your arm." So when you actually go through this scenario, you're actually talking through the process. You might take the time with the students and actually say, "How does Ben feel and why?" So actually reflecting on the feelings that might be going there, and having these conversations in an open setting, in the classroom setting, can help to facilitate conversations. It can also help to kind of identify where someone may be struggling with identifying how to coordinate and collect as it relates to what's going on. Because when you listen to the scenario, it's all the steps are correct and the process is effective. However, the empathetic part is not necessarily there. And so that's where you can have the ability to kind of teach the skills that are needed as it relates to having conversations. And I know for me personally, that was one thing I think whenever I was starting to do something new as a student, as a nursing assistant. I remember the first time that I had to put a patient on a heart monitor, and I was completely terrified because I thought, I'm on a cardiac unit. He just had open heart surgery. Putting this monitor on is going to be very difficult. And all he wanted to do was to get it on so he could go on about the way. But if I would have had someone to give me that opportunity to slow down, take a breath, understand the process, and then have to focus on empathy, it would have been a different scenario for me. So being able to have those different processes is very important with providing support to your students as they go through the process. So the next piece we're going to move into is actually looking at how do you build an effective scenario. So in this aspect, we're going to kind of think about what are the realistic components that need to be available in order to make the best learning environment, and also to help promote the key performance requirements that you're trying to support during this process. And so I'd like to start with the concept of having SMART goals. So we know about creating SMART goals. It's one way to kind of guide the process of building that scenario. Your goals should be specific. So I think about it, the completion of this training or the educational experience, what will the learner be able to accomplish? What skills will they take away from this training? And are you focusing on technical skills, soft skills, or both? So being able to kind of form and have those questions is very important. I have a checklist or a sheet that I usually kind of go through, and now it's kind of in my head. I don't necessarily have to use it immediately, but I use that process to make sure that, one, at the completion of the scenario, am I going to actually meet the goals? Do I have everything I need in place? And then two, is the scenario developed to meet the things that I want to have at the end of it? So using the blood pressure example, a specific statement might be that at the completion of this scenario, the learner will understand their role in communicating vital signs to the healthcare provider or the process to the patient. So this could be measured by how well you know if the objective is met. You're going to use a checklist with specific skills and behaviors students will need to complete to help you create a measurable goal. Using the skills listing for the 2018 NNAP for skills evaluation as a guide to build measurable goals is one way to kind of support your learning experience. We want to also make sure that this is an attainable goal. So if you have you want to know the skill level of your learners. So is this the first day? Have this their first experience being in a nursing environment, or have they been involved and engaged over time? And your scenarios are going to be very different. So if you have someone that's been engaged over time and they're about to be finished, your scenario can be a little bit more advanced. Versus it's their first day, you would choose a softer skill, or you might choose a different methodology for implementing this process. And then also you want to make sure that whatever you're doing is relevant. Creating a realistic environment is very important when implementing a scenario-based learning experience. You want to make sure that the tools are not outdated and the processes don't cause confusion. So as long as everything is relevant to what they are correlates to what they might see within a clinical experience. You want to make sure that you're able to do that. And then the last thing, when I think about building my scenario, I think about building the scenario that can be completed within a designated time frame. So you want to make sure that you're providing guidelines and parameters to help to build a realistic scenario. So if I know that I have 60 minutes for this time frame, I might choose to have a scenario that's based within a shorter time frame, like maybe 10 or 20 minutes or a little bit shorter, and then have time to include your conversations and kind of build through the process. The next thing is I want to define my intended outcomes for my scenario or for my simulation. So now that we've created this SMART goal and we've created the process that we want to have accomplished for the education session, you can take that content and define the desirable outcomes. For the current scenario that we have been building that's related to blood pressure cuffs, we can use the defined outcomes that are here on the screen. So at the completion of this scenario, the learner will understand their role in communicating vital signs to the healthcare provider. They'll clearly communicate the process of taking the blood pressure for patients, and then they'll utilize critical thinking skills to navigate barriers during the scenario. I've selected the soft skills of understanding their role in communicating vital signs to the healthcare provider. It's intended to allow them to, the instructor, to determine the participant's ability to kind of communicate and prioritize. Understanding the technical skills for taking a blood pressure have been taught during the lesson at some point, but our focus here is the intentional use of soft skills, whether they need to escalate and actually communicate the process. So integrating these key concepts that were introduced during the lesson and then take it into a step further to determine if the learner can problem solve issues that might be present. This would correlate to the outcome of utilizing critical thinking skills to navigate barriers during the scenarios. These defined outcomes also offer a method of knowing when to stop the scenario. So for instance, if you begin the scenario and determine that the technical skills such as how to apply the blood pressure cuff properly or proper hand washing are not demonstrated, you might stop and pause the session. I've done this several times when I'm working with either my students, and I notice that key steps within the process are being missed and they aren't able to kind of go through that process. And so they're not able to kind of get the higher level of that the simulation might act or scenario-based session might have. So being able to have the conversation with them and say what steps are missing, because it could be that they're overwhelmed in the scenario, or it could be that they truly didn't grasp those technical skills that we had at the beginning. And once we've walked through that process, I may either move to the next person, or I could start the scenario at the next point to help them to know kind of make the scenario the most effective for them, because I have to also remember what my intended outcomes were at the very beginning. It's also an opportunity for me to work on kind of the critical thinking and problem solving skills that are present. So if I have a scenario where I have a critical action that needs to take place and I have that checklist, I can help me to understand and make sure that all the skills are happening at the right time. Okay, so then here's an example of the critical action checklist. So we know that a critical action checklist provides the learner and the instructor with the guide for the scenario. So once the learner understands the objectives, the guide serves as an opportunity to effectively communicate accomplishing these objectives. The skills listing from the NNAAP is a good tool to use as a guide for developing scenarios for nursing assistant students. It provides an outline of critical elements that to be completed. These critical elements can be integrated into the critical checklist, action checklist. And here's just a sample. So I know I am currently teaching some nursing students for in our OB areas. And whenever we do our scenarios, we have a similar tool. It's not this exact one, but we utilize the critical actions that are needed. And I can kind of go through the process, and they also use it when they're preparing for the scenario so that they know what they should expect for, and how do they actually understand the process as they go through the scenario-based learning that day. Checklist also includes the objective that I created for my scenario earlier in the addition to the critical elements. So that helps me to know what exactly actually occurred in the simulation and scenario process, and where the learners are able to actually go through the process as well. All right, so now we're creating the scenario. And so we've created our action checklist, and we're going to begin developing the scenario. So first, determine where you would like to begin the case scenario. Will the scenario start at the beginning of a shift during report, or will the scenario take place in a community setting in the middle of the day? The starting point of the scenario provides the framework for the learner. It also allows them the time to process solutions they have used in the past. So once you've determined how the scenario is going to begin, you can formulate the key points that need to be included in the scenario based upon your critical action checklist. Your next step might be to include, is to make sure that you have all the equipment and supplies that are needed for the scenario. And this could be anywhere from, if you're actually using blood pressure cuffs, you want to make sure that you have the proper documentation form. So and I try to make my scenarios very realistic and it match the area that I'm actually working in. So if I'm working in a hospital setting, then I might try to have a computer match something that matches my MAR, or if I have something that is I have paperwork, I try to have the paperwork that's very similar, so it's more realistic, and and they can kind of go through the process and understand what might happen. You also want to make sure that you have the ability to make it very realistic. So if it's something that they're more likely to encounter, it's also usually helps them to be able to translate that knowledge when they encounter their real scenario. If this session is being implemented in a virtual setting, which I've had the opportunity to do several times of this past year, it's important to make sure that you test and trial the different platforms that you're making when you make the platforms realistic. So some of the platforms that I use when I'm doing this virtually, I have used Mural, Menti, Poll Everywhere, and Miro and Slat. And usually how I do this, I try to make sure that I begin at the very beginning of the sessions to have an icebreaker or an opener to allow them to become more comfortable with using whatever platform we're integrating, but then also allowing us to have the conversation. So if I'm using something like a Poll Everywhere where they can kind of go through and answer the questions using their phones, or it also have the opportunity to answer in the computer. And I also open it up to allowing them to answer in the chat box if they have questions. And then Mural is more, it's like a big whiteboard so that we can have, they can have further discussion. And I found that Mural was very effective for me to kind of see where their brainstorming was and their process mapping was, because I was able to see the correlation between their understanding that they had from the textbook, and then when they had to further go into scenarios to put the right answer where it should be, I was able to see more about their thought process and have further conversation in real time. So those were things that were very effective for me. You might also try and search for video clips or picture images of items to be used during your sessions to elicit further discussions. I know in some of our scenarios that I've used, I actually have been able to find clips of whatever scenario that I'm looking for. For me, recently, the most recent one was for the maternity unit, and we were able to find delivery images, and they were able to go through that process and have those conversations. And the videos don't necessarily have to be the best videos. It could just be that it's a video of a delivery, and then you could say, well, tell me what, in the scenario, how would you change it? Or in the scenario, is this realistic? And if it's not, what would you change? And those changes, it should be based on the education or your work plans that you've provided already. And so in our scenario, there were some instances where patients were left alone, or the process that we've done, that we talked about, the correct nursing process that we talked about implementing was not used. And so those things came out in our conversations, and we said, well, what would you do differently? And so that helps to kind of process and see what might be done differently during that time. So those are all things that have been very effective. But then also, after you've kind of gone through the whole process and you've thought about the equipment, you've made sure that you recruit participants for all roles, including like the patient, the staff member, and assigning all roles. You also want to determine when the scenario ends. So as I mentioned at the very beginning, or earlier in the last slide, when I have someone that might not be going down the right path, when we need to have more conversation, do I continue down that scenario? Or once certain pieces of the scenario are completed, then how do you know when it ends? One of the states that I worked with recently was implementing telehealth scenario-based training. They struggled at the beginning because they didn't have a complete start and end outlined in their pathway. And so the standardized patient wasn't sure when to end, and the facilitator wasn't sure to end. So when you create your scenarios, having clear ending points is important. Yeah. So when you build your case scenario, we've built the created scenario. Now we're building our case narrative. You want to make sure that you use real life case scenarios, and that can help build the case narrative. Taking examples from student debriefs at the end of clinical experiences can provide insight into key aspects or takeaways. For instance, some students might offer challenges that occurred during their clinical day with caring for a patient. And a realistic case narrative helps to facilitate the learning experience. And you can take some of the realistic scenarios and use them again in the future classes. One realistic case scenario that I can think of is when I was working with students, and they had a patient that English was their second language, and they weren't familiar with actually going through the process of using either interpreter or how to communicate. And creating a scenario and kind of walking through that with them was effective, because that way they didn't feel as scared when they were actually on the unit and having to go through that process. And you were able to help to navigate through them and provide an opportunity to have those conversations. So building the case narrative is important for your scenario. The next thing you want to make sure is having your instructor notes. They're simply tips and information that you want to remember as you facilitate the conversation and scenario. It might be helpful to have modifications to the scenario available based upon the learner in the room. So for instance, if I have a more advanced student, I may have a basic plan. And then if I have a more advanced student or learner, I may have a scenario that I can just kind of add in something different to help consider either that I can see more of the challenges that they may have, or if I have a student that may be struggling, I can also change another way to see if I'm still able to accomplish those goals that I wanted to have in the very beginning. So having a debriefing plan. I love to make sure that I have a debriefing plan, especially when I'm going through scenarios for the first time. If it's a new scenario that I've just recently created, or if it's a new, if I have a new team together and I'm going through this process. And these are the questions that I like to ask when I'm doing my debriefing process. I like to first find out what went well. So tell me everything that went well for this day. And it provides you insight on your scenario implementation, how effective the process was for the learner, as well as other challenges that might need to be addressed. And after using my debriefing process, I usually end up changing or tweaking something throughout the process. So when I think about what went well, I ask all participants to share at least one thing that went well, or one thing that was helpful during during our time together from their viewpoint. And that one thing can be anything that they might find. The next thing I go through are what were our opportunities, or what could have been better with more practice. So I have all of them participants to share one opportunity and this usually at this time, I'm usually able to actually facilitate more of a conversation and discussion about the process to identify either the gaps that they may have present during their learning opportunity, or the gaps that they may have that I may have had when I'm actually developed the scenarios. It could have been that they were a little bit confused in the process, or that my ending point didn't allow for them to go through the full process of understanding. And so those are some key points that I like to take away when I think about my opportunities. And then the next question I like to ask is, would you do anything different the next time? This allows for conversation to see if a different skill has been obtained. So if as they go through the process and they navigate, and it could have been an aha moment that they had, that if I could have done it this way, I would probably be able to provide this care to the patient this time. Or if it's related to a soft skill, I might have my conversation a different way. This helps to facilitate additional conversations. This could also be a time to identify changes that should be made in scenarios and implementation. So is there something that was confusing, or did I not have the right timing, or was there something missing? And this is also time that I would think about, did I have the blood pressure cuff available? Did I forget to have the blood pressure actual readings present somewhere for them to see or use it? The next thing I think about is what was the most meaningful thing? And I think about what is the key takeaway from this experience for the learner. And this for me goes back to the very beginning when I think about what objectives and outcomes that I want to have. But if something what else was their key takeaway or their key meaning that was most meaningful to them, then I can either enhance and make sure that it correlates. But it also helps me to see what how it has helped the learner and how they progressed overall. And this also helps you to kind of guide you through your objectives to make sure that you've been able to meet them. So now we're going to kind of transition into some sample scenarios. We'll just take a review over that. So this is the hand washing scenario. The World Health Organization has an online training that can be used with healthcare professionals to teach hand hygiene. The training includes a film that demonstrates when hand hygiene should occur. The scenario can be shown and incorporated with discussion to elicit critical concepts of hand washing. It also is included on this page are detailed slides with tips on when and how to discuss the scenarios with the learners. So as an instructor, you have it kind of lays everything out that you can kind of read ahead of time and then prepare for it. You could also take this a step further and use a scenario that involves hand washing, but focuses on the soft skills like empathy. So in our example here, you're preparing to bathe the patient, and part of the scenario is washing your hands. While the skills give more realism to the scenario, the focus of learning how to empathize with the patient is key for this area. And the next scenario we're going to talk about is donning and doffing PPP. So healthcare professionals have used scenario-based learning to ensure that proper techniques are used when donning and doffing. The initial presentation to the learner might include educational techniques and things to remember about donning and removing PPE. A scenario-based experience could focus on problem solving or conflict management. And when I think of some of the conflict management scenarios, I think of if you had kind of a background scenario, you're coming to a new shift tonight. The facilities are still practicing COVID-19 restrictions requiring all patients and visitors to wear face masks whenever there's a healthcare team member in the room. And after receiving shift report, you and the outgoing team round to meet the patients. You enter one room and notice that neither the patient nor the family are wearing masks when you walk in. And so that could be the start of the scenario. And then you can go in and say, hi, my name is Sam, and I will be working with you tonight. Due to the current COVID-19 pandemic, we ask that everyone wear masks when they're in the room. And then the patient says, hi, Sam, I don't want to wear the mask. The last person that was here didn't make me do that. And so this could be a branching point for the learner at that time, because to make the decision of, do you enforce that you have them put the mask on, or do you go with what your colleagues have been doing in the past? And so this could be where you actually ask that question: what would your response be next? And then you can list out the different options for them. So, well, I'm not the last person, and this is how I do it, or it's okay, you don't have to wear it. Or I understand that it's difficult to wear a mask all the time, but for our safety, it's the best that we wear one, and to further facilitate conversations. So these are that's another example of how you can have a branching conversation and kind of create a scenario and standard process to have further thoughts and conversations. The next one is the 1, 2, 4 all. I enjoy using this process when I'm having group discussions. And with the 1, 2, 4 all, with this method, you would present the scenario to the whole group and ask them to think about it by themselves. And then after a few minutes, thinking about the example by themselves, you can divide them up into pairs. And they start to have sharing with each other what they think and having those conversations. And then depending upon the group size, you can also take it a step further and have small groups of 4. And then finally, you bring everybody back together and you have a whole group discussion. By breaking them up, one, it allows those that are, if by end of first with the 1, if they are either introverted or they need time to just process, it lets them think about what they would do and what they would say. Then you bring them into a smaller group of 2, and they're usually more likely to have a conversation and facilitate, kind of build upon what they've already known and those knowledges. And then when they get to the larger group, they may or may not say anything in the larger group, but you know that at least that's given them time to have conversations between. The next one I'm going to tell you about is trying to find different scenarios. So you can look at lots of different places. There's books, there's websites, and also creating your own. That's probably my favorite, is the DIY, finding my own things together. So this is these are a few books on simulations, and you can try and also, like, if you Google some, and then there's different areas to do it. It can be difficult to find simulation scenarios that are designed specifically for one learner. So when you're planning your learning opportunity, remember to tailor your experiences to your students. You can scale up or scale back scenarios that are presented in these texts. These books can be purchased online, and many are available in ebook format. And usually what I do is I'll take a scenario, and I think about all the participants that need to be, all the roles that need to be present, and I scale my scenario to meet that need. Here are a few websites that are present that you can also have access to. The websites have scenarios that are built out and completed for nursing assistants. You got the Kansas Nursing Board has 16 different ready to use scenarios in their library. Then the Montgomery College has 16 different scenario topics that might be really useful for CNAs and the cultural simulation. Then you've got Global Network for simulation in healthcare. And there's different scenarios that are there. And then Laerdal has a site that has several complementary scenarios that go with the Annie mannequin and would be most appropriate for CNA such as like a colonoscopy care or feeding NG tube and therapy. Then there's the California Community College Health Workforce Initiative, has a lengthy list of links to scenarios in their sites. And CNA online link has an interactive communication scenario that would be really good for virtual learning. And the last three links included have 3 free CNA critical thinking scenarios you can use in your program, whether it be in person or remote. And I think we'll turn this over to for the reality-free scenarios.
Yeah, thanks, Kim. I just wanted to remind you that to not forget about RealityWorks. We have made all of our curricula for our health science tools and simulators available for free at the link that you see on the screen. And if you go to the link and you click on the type of training tool, it will take you to all of the lesson plans. And we have scenarios embedded in all of the lesson plans. For example, if we have a geriatric nursing mannequin. So if you clicked under mannequins, you'd come upon like 8 to 10 different lessons, but each of the lessons has an empathy scenario embedded in it. So we just wanted to point that out. You could check them out. There are dozens and dozens of scenarios. The one on the screen just happens to be an example of one. It's on pressure injuries, but there's just a lot of content out there. Next slide. And then, there you go. Here's a few other things to consider for scenarios. You can get industry involved, especially if you tap into some of your local, if you've got an advisory board. You can also get your students involved. Many of them have jobs and life experience that they may have scenarios to share. Talking to colleagues, we know more than ever our schools are tapping into business and industry people with experience in the field to teach. So you might have colleagues. Talk to family members who are involved with healthcare. They may have some excellent scenarios, very realistic ones they've been a part of or seen in their work environment. And of course, if all else fails, Google it. There's search terms like work role playing, workforce scenarios can bring forth many ready to use things that you could plug into your program right away. Kim, I'll turn it back to you to go over some of your key points.
Okay, thanks. So my key point, scenario-based learning uses real life scenarios. You want to make sure that the learner's able to find it helpful when they're able to relate to the clinical experiences that they encounter or may encounter. So using this method of learning can help to promote critical thinking skills and reinforce knowledge. This method can also be a validation method to ensure critical concepts are clear. So you want to also remember to use SMART goals when you're creating, as you build your scenarios. Define your desired outcome. of the scenarios at the very beginning so that objectives are clear and understood. Using an action checklist can serve as a guide for facilitator and the learner during the scenarios. The case scenarios used during the sessions can be incorporated, can incorporate needed equipment and scripts for those participating. At the completion of the scenarios, there should be a debrief to kind of to further augment and understand the conversations that you had. The debrief serves as a method to discuss what went well, what opportunities were presented, and how this knowledge will be used in the future.
All right, thank you, Kim. And now I'm going to share some resources that you can use to teach CNA soft skills. We've got a few brand new things that we'd like to point out. First of all, we've got a few things called Nursing and CNA Skills Sim Kits. We know that saving time is really important to CNA instructors. So we've kind of got scenarios in a box, if you will. There's 5 different ones available. Each of them has a main focused area. For example, for CNA, we've got sensory impairment. We've also got a mobility impairment one, but each of them includes 3 ready-to-use scenarios. And we've also included some of the simulation props needed for the scenarios in the box so that you could kind of get more buy-in with your students when they have those props. But it has an extensive scenario guide in it, which has all of the roles, the pre-brief and the debrief questions. There's a lot of information there. Here's all of the things that are in that guide, in addition to the props that you get with each of those skills sim kits. You get the scenarios, the setup, the environment, you get descriptions of all the patients. Again, you get those key pre-brief and debrief questions, and it comes with lesson plans that integrate how to use the skills sim kit to make it very, very easy. So those are available on our website that you can check out. We've also got a very simple way but effective way to weave soft skills into your classes, and that's with our pathway scenario cards. And we have 5 different cards available for health science. The one that we think connects best to CNA skills, we've got 2. There's a nursing one, and then there's a geriatric cards deck. We've also got medical assistant, EMT, and sports medicine as well. And we're going to share a scenario from our card deck on geriatric patients. This is one that just happens to focus on communication. In each deck, there are 19 different cards. Each one has a different soft skill that is focused. So you can see there's the scenario that's on one side of the card, and then on the other side, you've got points of view to consider, and then some of those key questions. So this would be a great icebreaker activity, like Kim talked about before, or you could even use this to wrap up the end of a lesson. It's a very, could be just a 5-minute thing. You could turn those key questions into discussion with peers or even a whole group, or written activity. And you can see how you could also adapt something like this to virtual learning, where you could share the scenario for your students to read and then submit the key questions and answers as a written activity. So here are just a few more free resources that we've got available for you. First of all, we have webinars every month, just like the one that you see today. You can go to our webinar link there and you can register, and we always send out the recording. We also archive everything that we do, but if you've not been around our webinars before, if you go to our archives, you will find dozens of related health science webinars, usually about 30 minutes in length. So we would just like to point that out, that you could go there. Some of the other things that we have are a blog, and we frequently have guest blog writers that have lesson plan ideas, and sometimes we do new product launches there. We are also very busy and active on our Facebook and Twitter. So those are just a few things that we'd like to point out. So at this point, we would like to open it up for any questions that you might have. And I'm going to go into the chat, and I'm going to see here if I can identify any questions here anybody might have, or if anybody has typed them in as we've been going along. A lot of you, I see at the beginning, had identified the type of instructor you are and where you're from, and we really appreciate that. It helps us to know our audience so we can kind of tailor our information a little better as we present. One person did say, could we see the screen that had the resources for scenarios again, or email to us? And yes, we have a document that you will get in your post-webinar email that has all of the links that were on all of the slides. So it will make it very easy for you to get back to that. It says, do you have anything for medical aids? We have things, like I said, for CNAs. So those would be the closest we have for a med aid. Says, will PowerPoint slides be emailed to us? Yes, you will receive the presentation as well as the recording link. So if some of you have to leave or had to leave early, they can be assured that you will receive all of that information today. So we would, again, I'd leave it for an extra minute to see if anybody has any parting questions for myself or Kim before we sign off today. I'd really like to thank Kimberly for all of the great information she shared with us today, for building scenarios, ways to find them and use them in the classroom. I think that those gold nuggets can be used whether we're virtual, hybrid, or in person. So thank you so much, Kimberly, and you're getting a lot of thanks in the chat information as well. Thank you for being with us today, and we appreciate the time. Have a great day.
Denise, there is 2 questions left in the Q&A section.
Okay,
Somebody is wondering the cost of the sim kits.
Those are $9.99. $999. Yep.
And then how long does it take to get an order of the sim kits?
Those I believe can be shipped out within 2 weeks.
All right, now it looks like all of our questions are answered.
Thanks for catching those, Em. I really appreciate it. Well, with that being said, thank you all for attending today, and have a great day.